Sorry, just setting up the recording, guys, and getting everything in here. Um, okay, welcome. So happy to have you all. I'm Allison Oswald. I am a pelvic health physical therapist, and we're going to have a great chat this afternoon or evening for you East Coast people. I've muted everybody. Obviously, you can unmute yourself if you have something to say, but something that I would recommend if you have any questions, we're going to utilize the chat function at the bottom of the screen. So I might ask you guys some questions and you can just type them up there, or if you have anything for me, I'll kind of be glancing at that and kind of directing our conversation. And then the other tip is if you want to pin my screen, and some of you guys might be super Zoom savvy and already know this, there are 3 little dots at the top of my screen where I am, and you can pin me so that comes up a little bit larger, and then you can see me and me talking, which might make it a little bit easier to follow. So first of all, I just kind of want to get a lay of the land of what all of you guys, where you are in your pregnancy journey. We're focusing this on, preconception all the way to postpartum. So just a little note of, are you pregnant? Are you trying to get pregnant? Are you postpartum? And kind of where you are. And then I can guide it there. And also maybe where you're from. Where are you guys? Are you East Coast, West Coast, somewhere in the middle? I'd love to get an idea. And we have lots of pregnant, 16, 37, someone's about to have a baby, 40 weeks. Oh my goodness. So we can talk about a lot about preparing to have these babies. So exciting. Congratulations to all of you guys. Okay, so I am going to, someone pregnant with twins. That's great. I am going to just start first by giving you an idea of who I am and what I do and the types of clients I work with and kind of issues or wellness things that we work on, just to give you guys an idea of questions that you can ask me and things that I can help you with possibly. So as I said, I am a doctor of physical therapy. I am board certified in women's health. So my specialty is everything around the pelvis. And so that entails obviously the pelvic floor, which we're going to be talking about. I work with women who are trying to optimize their fertility. So I do some manual techniques. We talk about different exercises and different type of movements to kind of facilitate that. I work with women during pregnancy that might be having pain. There's, a lot of people during pregnancy have what we call pelvic girdle pain or low back pain or sciatica. Usually we don't know about these things until we actually have them. So I'm not sure if any of you are suffering with anything during all of these pregnancies. If you are, feel free to write them in the chat and we can talk about them specifically and maybe some ways that we can ease some of those aches and pains that you're having. I work with a lot of women that are experiencing incontinence. And so that's when we're leaking uncontrollably, whether that's a little bit or a lot. And then on the end of pregnancy, sciatic tips would be helpful. Of course, we'll get to that. I work with a lot of women at the end of pregnancy talking about like different positions that you can get into labor based on what's going on with your body and how to optimize the opening of the hips and the opening of the pelvis to have a vaginal birth if that's your plan. And then on the postpartum end, we talk a lot about restoring the core. So how to bring the pelvic floor strength back after you've had a baby, how to help prevent or heal from something we call diastasis, where the abdominal walls really separate so far that they have a hard time coming back together. And then also just reconnecting to this now new body postpartum. I'm really a firm believer in a good way that after you've had a baby, your body is different. And it's not about getting it back, but it's about, okay, how can I make this body strong? How can I feel my best? Because being a mother takes a lot of work and a lot of energy. And you need to be able to build up that strength as much as possible. And then I also work with women on returning to intimacy after having a baby. Having sex postpartum for the first time is scary for people. And I get it. You know, I have 3 babies of my own, and each time it was scary. It's new, you know, a new terrain, and you don't know what it's going to feel like and what's normal and what's not normal. So we can talk a bit about all of those things as well. So I'm just going to look through some of these comments. You guys are writing what you might be interested in, and sciatic we'll talk about for sure. Pubic symphysis, SI joint, all of these are great. So everything related to the pelvic floor. So let me start by giving you guys a little education about what the pelvic floor is and what your core is, so that these things make sense for you. So the pelvic floor is a group of muscles when we talk about the pelvic floor, and it's a group of muscles at the base of your pelvis that connect your pubic bone, which is in the front of your pelvis, to your tailbone in the back. So we think of them like a sling of muscles. And these muscles they're holding up, for all of you that are pregnant, your baby right now. And when we're not pregnant, they're holding up our bladder and our uterus and our rectum and our stomach and all the organs that are inside of our core. And these pelvic floor muscles, in order to be working properly, they need to be able to stretch when we go to the bathroom, when we have intercourse, when we're birthing a baby. And then they also need to be able to close and contract up when we are sneezing or coughing and we don't want to pee our pants. When we are trying to use our core to do exercises, that needs to happen. So they need to be able to contract up and give you some support. And so it's not just about, you know, doing Kegels and tightening all the time, because there are a lot of functions in our life, like I said, where we need those muscles to stretch and to lower and lengthen down. So that's what the pelvic floor is. And the pelvic floor is just one part of our entire core system. So our whole core system, which is what gives you stability and what allows for proper sexual function and what allows for good blood flow and good function of all of our organs, is your pelvic floor on the bottom, like I said, that sling of muscles. It's your diaphragm on top, which is our breathing muscle. So if any of you have read anything about pelvic floor health or have begun practicing breathing techniques for labor and delivery, this is why. Because what happens with that diaphragm on the top, and the diaphragm, I'm just going to stand up here, is right underneath your chest. For those of you that are pregnant, you're probably feeling like your diaphragm is being pushed up into your throat if you're near the end. And it's the top of your core. So if here's your diaphragm and here's your pelvic floor, the contents inside are all of your organs, or a baby or babies. And these two structures work together constantly. So when you breathe in, your diaphragm goes down and your pelvic floor goes down. So they both kind of go down like this. When you exhale, they both come up like this. So if they're functioning in this way properly, and that relationship is really good, then your core system can really function well. You have good stability, you have good alignment, everything's doing what it's supposed to do. But during pregnancy, that relationship gets very shifted, namely because we go from being, I'm going to stand up again, we go from being like this, straight over the top of each other, to now we're out here. And we are holding our bodies differently. Our stomachs are pushing out and we are leaning back because we need to counterbalance gravity. And we're trying to keep ourselves balanced. So then that diaphragm and that pelvic floor that were right on top of one another and could work really nicely together don't work as well together. And so that's where I come in, and I try to help and optimize alignment and try to give women a sense of some control of that core system again. So for all of you that are saying sciatica and pubic symphysis dysfunction and pelvic girdle pain, it's because of that now asymmetry where those two are not communicating as well together. So ways that we can try to ease that. So we'll go right into, and I'm going to stay with right now during pregnancy, because I don't think I read anybody that is postpartum right now, like in the immediate postpartum. But if you are in the immediate postpartum, this still applies to you, because oftentimes postpartum, we kind of get stuck in our pregnancy posture, and that can really affect how we're healing and how all of our structures are healing. So the first thing that I always teach is alignment, is how can we get our rib cage to be over our pelvis a little bit more aligned than we typically would be. So that goes back to how we're standing and how we're carrying our body. So when you find yourself in a standing position, and I don't know if some of you are standing right now or sitting, but we'll start in a standing position. What you want to feel is you want to feel that your rib cage and your pelvis are right over the top of each other as much as possible. I don't want you to lose your balance. If you're super pregnant, you might be shifted back slightly, but you're trying to find like that you're still standing up tall and you're not sinking into your body, so to speak. So that's kind of step one in a standing position. So when you're on your feet, you should really feel like your feet are grounded to whatever it is that you're standing on, that you're not shifting your weight off to one hip, or if you have one older baby or a toddler and we tend to like shift over into one side, we're trying to avoid that as much as possible. And the reason being goes back to that pelvic floor and that diaphragm, is we're putting pressure on those systems that we shouldn't. And this kind of loops into something also that I teach a lot, is it's not always about that, 20, 30 minutes of exercise that you do every day. Oftentimes, pelvic health is about what you do throughout the day. So I try to give as many tips, things that you can do during the day, how you hold yourself, how you carry your baby, how you exercise, to try to take the pressures off of your pelvic floor. And this totally relates to women that aren't pregnant, to women that might never be pregnant, who are older, younger, it doesn't matter. This is really optimizing your function. A lot of pelvic floor work can benefit GI dysfunction, and can help to eliminate constipation, and any sort of low back pain. So they're very much intertwined. So alignment is that first key. When you're in sitting, a good tip is to, I'm going to lower my screen down a little bit, is to take your hands to your hips, and you can kind of rock back and forth a couple times to try to find what we would call your neutral spine. And your neutral spine is right when you're in the middle. So if I'm rocking all the way back, sometimes I'll refer to that as a 0, all the way forward is a 10, and you want to stop right in the middle, which is a 5. So you're like right in the center of your body. You feel really stable. You feel like if someone were to come up and push you, you wouldn't move anywhere. You'd be really stable in where you're sitting, which is really important. And that's going to make sure that your pelvic floor is exactly where it needs to be. So that kind of summarizes alignment, which is key. So for all of you with sciatica, for all of you with pubic symphysis dysfunction or any sort of pelvic girdle pain, start to think about that. And I think there were a couple of you that wrote, sneezing or coughing and leaking a little bit. So when we sneeze or cough, we often go into a rounded back position. That changes your alignment, that changes the pressure pushing down on the pelvic floor, and that can lead to sometimes more leaking. Your pelvic floor can't handle that pressure when you're back like this, but it can handle your pressure when you're in a little bit more neutral. So try to keep that upright position while you're coughing or sneezing. Bring your arm up to your body. Sometimes having another hand underneath your hand when you go to cough or sneeze can help keep you stable. Or if you're home and you have somewhere to hold on to while you're sneezing or coughing, that can be a great tip to try not to create so much pressure in your midsection for pushing down. So the second piece is breathing, how you breathe and how you use your breath to distribute, again, some of those forces that are going down on your pelvic floor. So looping back to diaphragm and pelvic floor and their relationship, when you inhale, the pelvic floor drops down. When you exhale, it pulls back up. So when it drops down, that's what we want to focus on when we're preparing for labor and delivery. And I'll get to that in just a moment, of how we can get the pelvic floor to relax and to drop and to open up to have a vaginal birth. But when you're experiencing pain, what you actually need is the pelvic floor to turn on and to give you some more support. So since it turns on or it contracts on the exhale, we would do a pelvic floor contraction when you are exhaling. So for all of you that have the opportunity to do this right now, while you're sitting there, you can take an inhale and blow out your mouth. And again, take another inhale through your nose and then out your mouth. And what you should be feeling is that when you inhale, your ribs expand out to the sides. So again, you inhale, the ribs expand. That's when the pelvic floor is dropping down. That's when everything, the air is coming into your core to give everything a stretch, to kind of open everything up. And then when you exhale, everything is coming back together and closer to your body and giving you a little bit of support. So on the next exhale, we're going to try to do a Kegel, which is a pelvic floor contraction. It's when you're squeezing the pelvic floor and you're pulling up and in. So some people will say, you know, it's like you're pulling a marble up through your vagina, or you're pulling a tampon up and inside. That's the active part of the contraction. And then when you inhale, you let it go and you open up. So we're going to try to do the tightening part with it. So you're going to take an inhale, and on the exhale, you're going to pull that pelvic floor up and in. For those of you that are pregnant, you'll actually see your belly pull a little bit closer to your body. You're turning on that internal corset of your core. You're giving yourself a little bit more support, because during pregnancy, the hormones, especially one called relaxin, makes those ligaments and makes those joints a little bit more lax. So we don't have as much stability. So we have to actually contract a little bit to give us help. So if you have sciatica, if you have pelvic floor or pubic symphysis dysfunction, try to exhale through your mouth, engage your pelvic floor and your lower abs, and see if that helps with the symptoms. You have to practice that in a lot of different positions and try to turn it on. And then it's going to feel like, oh, I have to really think about this, but you really do, because those things get shut off during pregnancy. And if that still doesn't help, then sometimes women need a little belt or a support called an SI belt. And that goes around your pelvis. I don't know if I can stand up high enough, but it goes around your pelvis right really low, below the baby or below your bump, so that you can have a little bit of hug or support for those joints, because you might not be able to create as much support as you need. So wearing a belt can be really, really helpful for that. The tightness that is created in your glutes from that new alignment or that posture that you're in can really contribute to sciatic symptoms. So I always give all of my patients that have any sort of sciatica either a small massage ball that they can put up against the wall, and you just kind of roll around on it in your glutes. It helps to break up any tightness around that sciatic nerve. I do say, with a word of caution, if you are rolling on that ball and you're feeling your symptoms really spike up, like I say, kind of the nerve is talking to you and like, oh, I really, really, really feel my pain, like shooting sharp, back off a little bit. You don't have to be right on the nerve, because nerves don't like to be pressed for a long period of time, and you'll just aggravate it. Think of kind of grazing around like the hot spot of where you feel your pain, and loosen up the tissue that then's connecting to where that sciatic nerve is. And that sciatic nerve, for most people, runs directly through the glute muscle. You have one on each side. So I love a small ball, a tennis ball even. Some people use a lacrosse ball, and use it against the wall, because getting down on the floor, especially if you're, in the end of your pregnancy, that can be tricky and uncomfortable, and you have to kind of contort your body. So using a ball can be really, really helpful. For the woman that asked, Gabriella, you asked about waist belts. Are you talking about the SI belts that I mentioned, or the postpartum abdominal binders? Just let me know, and I can tell you Right now, the SI belt that I love is the Serola SI belt, Serola. It's not marketed to be a pregnancy belt, though it is my favorite. I used it myself, and many, many of my clients have. It's super comfortable. It's made out of this soft neoprene, and it can go directly around your skin. You don't have to put it on your pants, which is great. So let's get back to where I was with the breathing. Let's see. Yes, so Jill asked, do you do a Kegel while you're pulling up on the exhale and then just relax on the inhale? So great question. Yes, that's essentially what you do, but know that the relaxing or the letting go of the pelvic floor, it's not like, oh, I'm just letting everything go. We're more just lengthening it down. So it's still strong. You still feel a connection, but you're no longer pulling up and in. You're now inhaling in and stretching it out. So maintain your alignment, but when you inhale, yes, it drops down and goes out, so to speak. And you can see if you're actually doing this. There are a couple ways that you can check your own pelvic floor. First of all, you can use your own finger. If you want to insert your finger into your vaginal opening, you can exhale and squeeze, see if you feel a squeeze. There are a lot of exercisers out there now, pelvic floor exercises on the market. LV is one of them. I think I saw a new one the other day called the Kegel Sizer or something. That is essentially doing this. That is giving you feedback of, okay, am I actually doing a pelvic floor contraction? So you can insert your own finger. You can see, do you feel a contraction? And then do you feel a lengthening down? And this is something that if you've never done this before and you're about to have a baby, do it, because it gives you such a connection to your own body that you can make this connection of, am I contracting? Am I relaxing? Oh, wow, I have the ability to control this. It gives you so much empowerment going into your delivery if you're able to really feel that contraction happening. If you're not comfortable doing that, you can take your fingers and you can touch right outside of the vaginal opening. The space between your vaginal opening and your rectal opening is called your perineum. This is a space, this is where a lot of women have tearing during delivery because this tissue is very strong. So when you put your fingers there and you do a contraction, you should actually feel that tissue lift up closer to your body. And then on the inhale, you should feel it drop away. So it doesn't move a ton, right? It's just little bits, but you feel it change underneath your fingertips. And that's essentially what you're looking for with that contraction. Let me look here. So then, and we'll talk about a little bit of prolapse. So then the last thing, so we talked about alignment, that's the first. Then we talked about breathing. And then the last part of kind of how to connect to your core is C. So alignment A, breathing B, C is your connection of using that connection, that exhale and that contraction during function. So going to pick something heavy up off the floor. If you have a toddler, picking that toddler up off the floor. Exhaling through your mouth, engaging your pelvic floor and your lower abs, and giving yourself that internal corseting is going to help with some stability, decrease the pain in your lower back, decrease the ability for your stomach to overly stretch or lead to diastasis, and make sure that your pelvic floor is still functioning and doing what it needs to do. So you want to carry that into your exercise. So when you're, depending on what types of exercise you're doing, anytime you feel like your core doesn't feel stable, you can use that contraction of that exhaling and pulling the pelvic floor and lower abs in to make yourself feel more comfortable and to make your body feel better and lead to less strain. So those are kind of the three big points, the A, B's, and C's: alignment, breath, and connection, of just trying to maintain a sense of connection to your pelvic floor and your whole inner core system. One question was asked here about, where did it go now? Hang on one second. The perineal massage. So I mentioned the perineum, okay? I typically teach women around 35 weeks to start doing perineal massage. And if you have not heard of that, this is where we're trying to prime or prepare this tissue to stretch for labor and delivery. And, I always say ask your provider first just to make sure you don't have any high risk against this. I've never in my years of practice had any doctor say not to do it. I've had, many OBs that would say, oh, we don't even know if it helps. You don't need to do that. And my belief and what I've seen in my practice is if it does nothing else than just get you to feel what stretch feels like in that area, why not? Because if you can prepare your body physically and emotionally to feel what that pressure feels like there, which you're going to experience during delivery, then why not? And let's try to prevent tearing, and let's try to keep this tissue as healthy as possible. So to answer your question, how to do this, you would do it a couple of times a week, again, starting around 35, 36 weeks of gestation. And I usually recommend that you get down on the floor of your tub, or if you're in a shower, you put 1 foot up on, if you have a little stool in there or a little landing, or the edge of the tub, if you have like a standing tub situation. And then you're going to take, so if your left leg is up, you're going to take your right hand and use your thumb. And you can use a little bit of lubrication, anything that you typically use at home. And you're going to insert your thumb just barely into the vaginal opening. And your pad of your thumb is facing towards the back or towards the rectum, but your thumb is just partially in the vaginal opening. And you're going to press down with a good enough pressure to feel the pressure, right? So you want to feel it. You're going to hold that pressure down, and then you're just going to swipe your thumb in a horseshoe shape, because we're trying to stretch. If you think of the vaginal opening like a clock and the top or the front being 12 o'clock, you're trying to swipe from 6 o'clock over to 3 and back over to 9. And it's been shown that, just a couple of minutes, maybe 4, 5 minutes of doing this kind of sweeping motion, you can stop and hold some sustained pressure for a little bit, trying to breathe, trying not to clench, trying not to do a Kegel at this point. You're trying to down regulate or down train the pelvic floor. Has been really helpful. So that's how you would do it. You can also do it with a partner. If you have a willing partner that's wanting to help you, I always suggest get into the position that you're anticipating you're going to deliver in. For those of you that are going into the hospital, if you plan on having an epidural, really your only options are lying on your back or lying on your side for delivering. And I would recommend lying on your side if you do have that option, just because it allows your tailbone and your sacrum, which is at the back of your pelvis, to move a little bit more freely. And then if you plan on having an unmedicated birth, or want to labor as long as you can with without medication, maybe get into a squatting position and have your partner do that with you, or get into a hands and knees position. So you're prepared for it as much as possible. Because I think that's the scary part about labor and delivery, even if we've already had a baby, but especially for the first time, you just don't know what to expect. We've seen the movies, we've gone to the classes, or we're having the virtual classes in this case. So it's putting yourself physically in those positions to feel what that feels like, and to practice some of these breathing techniques. And like I just described, the perineal massage, which I think is really awesome. Let me just look through here and see what else we have. Yeah, Sophie, you mentioned the Studio Bloom, which I have only seen bits and pieces of that, but I think it's excellent. I mean, any of these new pregnancy workouts that are drawing attention to the connection between the pelvic floor and breath and how to engage your abs properly, I think are hugely beneficial. Again, you're creating this communication with your body that you're going to be able to relate to during labor and delivery, and really, even more importantly in my book, postpartum for the healing. You'll be able to find that connection again so much more quickly than if you don't during pregnancy. So I think that those are great. Is it sufficient as preparation? I'm assuming you mean for preparation for labor and delivery. I don't know if they go, if they talk about different positions of labor and delivery. From my understanding, they just do exercise. It might be beneficial to either talk to your provider or a birth educator or a women's health PT to just kind of walk you through what some of those different positions look like. And I'm pretty sure, again, I can't speak totally for this Studio Bloom that you're mentioning, but they should, near the end of your pregnancy, again, after like 35 weeks, start to do what we call down training the pelvic floor. So this can loop us into now talking about preparing for labor and delivery. So as I mentioned at the beginning, to connect to the core, to make your core engage and give you that sense of security and stability, we exhale and we pull the pelvic floor up and in, right? But near the end of pregnancy, we don't want to do that. We don't want to tighten the pelvic floor so much. We want the pelvic floor to be flexible and fluid, and most importantly, have the ability to stretch and expand in a really safe way to be able to have this baby or babies. So at this point, this is when I start working with women to open up the hips and pelvis. The only caveat here is if the baby is in a breech position. There are some specific moves that you do to try to get that baby to turn. But when your baby is in the correct position and you're ready for labor and delivery, this is the time that we do a lot of hip openers, deep squats, cat-cow, and focus on letting go of the pelvic floor. So there are different references to this, but we can call this kind of the pelvic floor down regulation exercise. So when you're in our sitting position, if we go back to our breathing, and again, when we breathe, our rib cage should expand 360 degrees. For those of you pregnant, we're breathing in to the baby, right? You're not bringing air up here. That's really driving our sympathetic nervous system, our fight or flight. It actually tightens everything up. We want to breathe down and breathe down into our rib cage and into our pelvis to enable that parasympathetic, that calming, that resting, that ability to allow the pelvic floor to let go. So anything we can do to down regulate in this phase is what we want to do. So in this case, when you breathe, you would take a breath in through the nose. Imagine the pelvic floor dropping down. Imagine the baby dropping down. Imagine everything just kind of letting go. If you were sitting on a ball at this point, a birthing ball, you might even feel the pelvic floor, the perineum, drop into the ball, which is awesome. That means that things are starting to drop in. When you do that, on the exhale, instead of now engaging the pelvic floor up and in, try to exhale and leave it down there. So it's like you're trying to stretch the pelvic floor on the exhale. There might be a slight recoil. It might start to come back up a little, and that's okay. But you want to try to think about it dropping down even more. So after 35 weeks, I would say every day for 3 to 5 minutes, get into a comfortable seated position, hands and knees position, and practice breathing this way of letting go during the exhale. So you're actually really thinking about stretching and lengthening the pelvic floor. And then one other note that has seemed to be a constant with a ton of my patients in the last 2 weeks that are about to have a baby is the idea of what we call open glottis or open mouth pushing when you're actually having a vaginal delivery. So very often, especially in a hospital setting by either a nurse or a doctor, you are told during the very active phase of pushing to take a breath in, to hold your breath, do not breathe, and push with all your might down through your pelvic floor. And we have seen time and time again that this type of pushing decreases oxygen to the mom, decreases oxygen to the baby, and can cause more trauma to the pelvic floor, because that is a ton of pressure, right? It's so much pressure pushing down on the pelvic floor, which is why they teach that. But we are starting to uncover that you can do an open mouth breath. So you think of your mouth as kind of like a release valve so that all the pressure isn't going down. Some of it's being released through your mouth. You can still push just as effectively with your stomach. So your stomach muscles are contracting with your uterus. You're letting go of the pelvic floor, but instead of holding your breath, you're just going while you push. So I encourage you to try that during labor and delivery, because I have seen in my own deliveries that it has worked awesome, and then it's worked for a ton of my clients. So a conversation to maybe have with your provider, because it can be a scary situation, or you kind of just do what they tell you to do during labor and delivery. So just know that there are some options and different ways that you could breathe while you're pushing that baby. Okay, so let me see. When is the end of pregnancy when you should stop doing pelvic floor exercises? That's a great question. So the only indication for actually doing a ton of pelvic floor strengthening is if you're having issues, right? So if you're having leaking, if you're having pressure down in your pelvic floor, if you're having SI pain, you're having to use those muscles a little bit more to give you some support. So yes, around 35, 36 weeks, we start not doing as many of those. However, for function, if it hurts to bend over and pick up your toddler, if it hurts to get up out of bed, you might still need to do them, meaning that when you roll over, you might have to exhale and engage your inner core to give you some support to do those things. And you don't have to stop doing that. But you just might not do, if a provider has given you, I want you to do these 3 exercises, those might need to be adjusted at that point. And then also don't hesitate to use other types of supports. Like I said, the belt, or sometimes even some leggings that have a little bit more compression in them. Because if they have compression, then you don't have to tighten everything to give yourself support. So you're able to let go and have that sense of letting go to prepare for labor and delivery. So it means that to stop doing Kegels, you start shifting your Kegels. So if you're just doing Kegels just to feel your pelvic floor contracting, that's fine. But now we can shift that from the tightening part of the Kegel to now we're letting go. It's good to always be able to know that throughout your pregnancy, all the way till the end, that you could still contract and pull the pelvic floor up and in, but you don't need to, nor do you want to at the end of pregnancy. At the end of pregnancy, yes, we still want to be able to use our abs because those are going to help your uterus push the baby out, but now we want the pelvic floor to let go. So unless it's indicated, meaning that you have pain, you're having dysfunction, and you need to really squeeze that pelvic floor at 35, 36 weeks, I would say you don't need to do it anymore, especially not as an add-on to any sort of other exercise program. I remember I've been out of school a long time, but when I first got out of school in 2006, they used to say, oh, every pregnant woman should do 80 to 90 Kegels a day, no matter what. And that's just so not true. So if you're doing them just because you don't need to be doing them, do them with function. Do them when things are challenging. Do them when you're doing other sorts of exercise, but don't just do them flippantly, should I say. Let's see. Okay, so this is a great question. I feel like I'm stretching out my belly skin when I do deep breathing, so I find I don't breathe very deeply. Can the skin rip from breathing too deeply? I have never seen skin rip from breathing too deeply. I will say that. However, I know that feeling. It feels like your belly can't stretch anymore. So I would ask you to direct your breathing into your rib cage. So your rib cage is where your diaphragm is, right? So if I were to take, and I'll do this with patients, I'll wrap a band, like an exercise band, around almost like the base of a sports bra. That's where you want to see the expansion. You don't really actually want to see the expansion in the front of your belly. You want to see it around the perimeter of your rib cage. That is different than belly breathing, just breathing into the belly. You want to breathe into your lower rib cage. So I would suggest like wrapping a TheraBand or wrapping even like a belt from your robe around that area of your body, and see if you can breathe into that robe a little, or that belt a little bit more, to get that expansion. Typically where I see women need stretching is in their side body so that they can breathe into their side. So any sort of like side bending stretch, even lying on your side and breathing into your side can be helpful to try to open that up a little bit, because I know that feeling of like just breathing into your belly, it doesn't feel great. And that's exactly right, because that shouldn't be exactly where you're breathing. But the deep breath is what's going to facilitate that diaphragm and the pelvic floor moving down. And that helps with blood flow, lymphatic flow, and especially getting that pelvic floor to recoil, which is really important. Let's see, from 27 to 35 weeks is from Jill. When we are exhaling and engaging the inner core and pulling up in Kegel, should we also do the open mouth release? So the open mouth, for sure, you're not holding your breath at all when you're exhaling and pulling the pelvic floor up and in. The open mouth release is really only when you're being told to hold your breath. So if I'm doing that core connection of the pelvic floor and the abs, it looks like this. I'm going to inhale through my nose. Ribs expand 360 degrees, pelvic floor is dropping down, and then I exhale, pulling that marble up and in with my pelvic floor, my abs tighten, and the ribs come back down together. So it's inhale and exhale. So yeah, there should be no holding your breath really for anything during pregnancy, because that just creates so much pressure pushing down. So you don't want to do that at all. Okay, let me make sure I answer all these questions. I think I skipped a couple of them. So let me just look really quickly. Oh, the belly band I recommend. Okay, so let's get to belly bands for just a moment. And again, keep typing any other subjects, areas that you want me to go into. There's so much more that we can discuss. But belly bands are different than SI belt. So the SI belt that I recommended is called Serola, Serola, and it's their Serola SI belt. And SI stands for sacroiliac, because those are the bones or the joint that we're trying to give a little bit of stability. Postpartum binders, I'm a little bit on the fence about. This pressure system of the pelvic floor on the bottom, diaphragm on the top, we have our deep abs in the front, and then our deep back muscles. So that's your core unit. I think of that like a tube of toothpaste, right? So in order to turn, what do I want to say? Kind of like keep the stability or keep the pressure equal. When you squeeze a tube of toothpaste, you have to squeeze it from the bottom to the top. So that's why we do a pelvic floor contraction from the bottom to the top. Because if you take that core and you just squeeze it in the middle, like a belly binder would do, and your pelvic floor is not fully recovered postpartum, whether you've had a vaginal or a cesarean, because the pelvic floor is being affected by the pregnancy, not just the delivery. If you go and squeeze that in the center, you're putting so much pressure down on the pelvic floor. So I have seen women come in my office had no pelvic floor issues until postpartum, because they started wearing those belly binding things really tight, and they weren't just laying down and relaxing, which is how back in the day they were intended for that first, fourth trimester of when you're resting and when you're not doing much, and it's trying to like close the bones, so to speak, and help the uterus contract back down. Those were intended to be used because the women were relaxing, they were resting, they were caring for the baby, and they had people caring for them. But now, unfortunately, women put those on and then they go back to doing everything they were doing before. They go on an hour walk, or they're lifting the baby and over because they don't have help at home. And that's creating a lot of downward pressure on the pelvic floor. So I've had women come in that then have prolapse. And prolapse is where any of your organs, whether it be your bladder, your uterus, or your rectum, are starting to fall into the vaginal opening, and in some cases start to come out of the vaginal opening. And it's because there's too much pressure up above pushing down. So I would prefer things like compression garments that are more like underwear or bloomers, so that you have some support from the pelvic floor and then wrapping around the abs. Even Spanx makes a pair of kind of like biker short pants, so that you can have some support from the bottom that then wrap around the rest of your core. And it feels really good, because after you've had a baby, you're like, I can't connect. I can't use my abs. This feels very funny. I have no support. And those things can add some support to you. But I would just be cautious in how you use the belly binders, to make sure that you're not displacing organs and pushing them down or putting too much pressure on that pelvic floor. Okay, I wanted to somebody had asked a question about prolapse, and I feel like it was up at the top. If somebody typed something about prolapse and I didn't answer it in that, if you can write it again, I'd love to be able to address that for you. Any recommendations for postpartum healing if you didn't do all those things during pregnancy? Absolutely. It is the same. You need to connect to your core. You need to learn how to align your body, how to breathe properly, and how to use that exhale, engage your pelvic floor and engage your abs during function. And you can do all of those things. And you can do them at any point. It's never too late. Women are starting to seek support sooner. There's a shift happening in the world, especially in this country in the last couple of years, where women are finally starting to ask for support. But I remember at the beginning of my practice, women would come in when their kids were in kindergarten, because they were finally giving themselves some time to take care of themselves. So it's never, never, never too late to do those things. You just want to think of addressing postpartum as such an awesome opportunity to build strength from the inside out. So you want to build that inner core, that pelvic floor and deep abs, because once you have that turned on and once you know how to use that, you go to any exercise routine or you go to any, daily function that you're doing, and you're going to get so much more out of it. You'll see a big difference. You'll feel a big difference. And so I think that you're still in good shape to be able to do those things. Let's see, exercises to help expand the pelvis the last few weeks before giving birth. Some examples, and other than releasing the pelvic floor. Great question. So there are many, many things you can do. And there are some general ones, but just keep in mind before I give any of these examples that I make them really specific to each person, because I don't know if there's anything underlying going on with your body. So if there's positions that are uncomfortable for you, if you have a herniated disc, if you have history of, a hip issue, there might be some of these positions that I'm about to say that I wouldn't necessarily give you. So just know that it's your body. None of these things should be painful, and they should all feel good, because again, we're trying to stimulate that parasympathetic nervous system, get everything to kind of calm down and lengthen. So the top exercises that I give are hands and knees and doing hip circles. So if you're on your hands and knees, you're kind of shifting your body around into hip circles. I have the knees open a little bit wider than the feet, just to give the idea of like, okay, we're opening up the inner thighs and trying to get your pelvis to move. And then you can go the other direction. You can do a kneeling stretch. So you're kind of in a one knee down, 1 foot up, and you're lunging forward and back. We're stretching and opening up the fronts of the hips. I love side bending like stretches. There's something in Pilates called the mermaid stretch, where you're stretching to the side, because we're trying to create some space in your pelvis as much as possible. Standing and walking are great for the end of pregnancy. Anytime we're sitting or more into kind of like a fetal position, that's compressive, right? That's closing things off. So we're trying to get into this sense of how can we open things up. And then two other areas, which are very much related to what is happening to the pelvis and the pelvic floor, are your jaw and your feet. So I would recommend for those of you about to have babies that you start working your jaw, because tightness there is often correlated to tightness in your pelvic floor, which also, kind of piggybacks this idea of opening your mouth to exhale while you're pushing, because we don't want to push through a really tight pelvic floor, nor do we want to push through a tight jaw. So just massaging there, maybe in the shower every day or at the end of the night when you're lying in bed, and just kind of noticing any tension or tightness. It's also a great tool for a partner to do during labor to help release that. And the same goes for the feet. The nerves that actually connect to our pelvic floor also give sensation to our feet. So stretching your feet and toes, rolling your feet on kind of those spiky balls are awesome. Two other places that can just really help to open up the hips and the pelvis, which I think is really helpful. Let's see, the best compression garments. So the medical grade compression, we have a great pharmacy here in LA, and there's a woman there that can kind of fit you with compression. They're not made for you like they would be for somebody with lymphedema. But I usually send my local moms there if they really need a lot of compression. Otherwise, there are just some online, and there's not one in particular that I love. They're kind of one size does not fit all, because depending on how tall you are, if you're getting leggings, some leggings are way too long, some are way too short. It's the same thing with compression. So I wish that I had like one that I absolutely love as far as compression leggings. But I do love, well, I guess these are compression leggings. She does make them. There's a company called Bebe Maternity, and they have, she is a physical therapist and created this. She has some postpartum bloomers. You can actually wear them during pregnancy too, that I really love. They're super gentle for the immediate postpartum. And then you can shift into more of her compressive leggings, or I think she has even like biker shorts that you can wear. And I think it's Baobei, Bebo or Bobe Maternity. I'll look it up, but feel free to DM me on Instagram if you can't find them, and I can send you the link to them. Prolapse sounds terrifying. It is not. It is so common. The specific stats I don't know, but I think it's once you've had 2 or 3 children, 50% of women have some sort of prolapse. So prolapse sounds terrifying. The amount of women that actually have prolapse where it's like coming through the vaginal opening is much, much smaller. But what we term grade 1 or grade 2 prolapse, which is just a slight descent of the organs, is actually really quite common, which is a good thing to mention in the terms of pelvic health. One thing that I'm trying to do and working on is to try to get rid of this idea of that common makes things normal, because it doesn't. And people even joke about it. I have 3 kids. Of course I can't jump on a trampoline. I pee my pants. Doesn't everybody? No, I can jump on a trampoline and I don't pee my pants. And I had 3 vaginal deliveries, and you don't have to either. So there's so many common things that come up with pelvic health. Or people saying that, of course, sex is painful. Is sex really, is it never not painful? And no, it does not have to be painful at all. Oh, somebody put the link for Bebo Maternity. Thank you so much, Andrea. I can't multitask and do that at the same time. So just know that, like, in this world of pelvic health, just because it's common does not make it normal. And most importantly, these things that are common, typically, and I would say 100% of the time, we have tools to mitigate symptoms. We have tools to help heal. We have ways that you can live a pain-free, healthy, feel good in your body life. You don't have to live with them. And somehow with pelvic health, there's just a lot of shame behind it, and people hold on to these things and don't seek help as soon as they should. So a little soapbox moment there for you. Let's see. Tips for getting back to sex after baby. Great question. I could go on and on about this. People have their 6-week checkup with their doctor, and it's like, okay, go ahead. You can, have sex. You can have sex when you feel like you're ready to have sex. Depending on your birth story, there can be a lot of things going on with your pelvic floor. I would say for 100% of women, it does not feel the same, at least the first time, because after you've had something come out of your body, again, whether it's be vaginal or cesarean, it just feels different. I always recommend postpartum that you use lubrication. If you didn't use it before, use it after, because even if you're not breastfeeding, the hormones in your body are still fluctuating. You oftentimes just don't produce as much lubrication. During pregnancy, it's such a time when we're producing so much phlegm, so to speak, in our body. You get nasally, you get stuffed up, there's all this production. And then postpartum, everything becomes very dry. So always use lubrication. Be really communicative with your partner of your fears, of what feels most comfortable to start, and see how you feel. And it's really developing that communication and relationship of this feels good, this doesn't feel good, this used to feel great, this doesn't feel great anymore, and just kind of walking through what that is. What you should see is that every time you have penetrative intercourse, that it feels a little better each time. If you don't see that progression, seek support and don't let it be dismissed of, oh, have a glass of wine and then try it. And I've had women come in and say that their physicians have told them this, because that's only going to perpetuate the issue. Sometimes there could be pelvic floor muscle spasm that a women's health PT can release for you and can teach you how to release it yourself. You check for scar tissue. If you have any tearing, is that scar? Is that what's giving the pain? Is the position of your uterus, is that shifted? And that's what's giving you pain. So there's a lot of different things to unpack, but the lubrication is key. The communication is key with your partner, and just making sure that you're seeing this progress of getting better every time, I would say would be really, really important. Okay, let's say. Yes, there will be recording. I am recording it right now. I hope. Yes, I am. And I believe from Hatch, you'll get an email tomorrow, all of you that were here or even just RSVP'd, and you'll get a recording of this for sure. Okay. Any other questions? Oh, type brand of lube that you would recommend. Yeah, I'll send a few of my favorites to Hatch, and we'll add that into the email that they send you so that you can have some of those links along with that baby maternity that Andrea put up there. Anything I missed? Oh, diastasis. Yes. Do I have a minute to talk about that? I'll talk about diastasis really quick. So diastasis is when the abdominal muscles, so the front part of that core system, separate, or actually I should rather say stretch to the point where they're not coming back postpartum to how we want them to. There is research that shows that 100% of pregnant women get diastasis during pregnancy. It's a function of our awesome bodies that we have, that we are able to stretch to build a baby inside of us, and we just want that to restore postpartum. So the keys to diastasis, in my opinion, are during pregnancy, making sure that you are not falling into that posture of leaning back, because when you're leaning back, you're stretching your abs more than what needs to be done. You also want to look for something called doming or coning, and it's where your abdomen starts to push forward. You'll actually see a little ridge in your stomach. For some women, as early as the first trimester, maybe the end of your first trimester, you'll see that start to push out. So that means that the pressure inside your body is too great for your stomach to handle. So if you keep pushing that, it's going to stretch it more and more and more. So you want to avoid any doming or coning. That deep abs, those deep ab muscles that need to contract and come back together after you have a baby, are connected with your pelvic floor. So after you've had this baby, doing that exhale breath that we practiced together today and engaging your pelvic floor and engaging your deep abs is going to help restore that diastasis. That's kind of the foundation work. And then obviously there's a lot of exercise and different type of movements and strengthening different parts of your body that kind of go together with those muscles functioning. But that's kind of the most important thing with diastasis for all of you that are pregnant is watching that doming or coning and making sure that you're not seeing that. And sometimes women see it even just when they like pop out of bed. So if you see that, roll to your side and push yourself out of bed. Do anything you can to avoid that overstretch. Anything else? I think it's just now 3 o'clock. That was awesome. You guys had such great questions. And good luck to all of you that are about to have a baby or babies, I think for one of you. I am based out of Los Angeles. I am currently just doing virtual or telehealth sessions, which I'm available for, and you can find all that information on my website, which is AllisonOswald.com. And that's the same for my Instagram as Allison Oswald. And then eventually, once safe and kind of client by client, at least in the Los Angeles area, I'll start opening up house calls again. But yeah, that's where I am. And it was a pleasure to meet all of you during this. Yes, thank you so much. And like I said, this will be it is recorded, and I hope I don't screw that up. And you guys will all get an email with all this information, and feel free to email me anytime. My email is on my website. It's also through my Instagram, or DM me, and we'll stay in touch. Goodbye.